Could you tell me a bit about Blood Cancer Awareness Month and what it means to you as a patient?
Yeah, what it means to me is making people aware of blood cancers. At least in my couple years since I've been diagnosed with WM, people don't think of blood cancers. Maybe a few better known, but when I explain to people about WM, and they'll say to me, "What stage are you in?" And I'll say, "Well, there's no stages." "Oh, you have that wrong." "Really? I do?" They just think, "Oh, you have it removed and you're all set." Blood
Right.
cancers don't work that way. So I do find that blood cancers, people don't understand what it's about. And then when I dive into WM, either their eyes glaze over or they just can't comprehend that there's not a cure for it, but there's treatments. And I always explain WM as they treat the symptoms, not so much my blood results. My wife has deemed it whack-a-mole. Depending on what symptoms I have is how they treat it. So there's education. So you call it Blood Cancer Awareness Month. I kind of look at it as Blood Cancer Education Month.
Right. Oh, that's such a good way to look at it. Yeah. Could we take a step back and you tell us a bit about your journey with WM? So, how
Sure.
long, when you were diagnosed, and, anything you'd want newly diagnosed patients to know about the journey in front of them.
Sure. Well, if once they find out they have WM, the journey probably was a couple years. I was fortunate. I started having neuropathy in my face. Kind of a weird situation, but I would wake up in the middle of the night and my eyes and my lips were completely swollen. And I just assumed I had a food allergy. I was keeping track of my food. And I said, oh, I was convinced it was this allspice. I had 2 meals on 2 consecutive Saturdays, and both nights I would wake up completely swollen. I went to an allergist. Allergist said it's not a food allergy. It would happen all over your body. It would be more immediate, not 12 hours later. And he ran some blood work, and he ran pretty comprehensive blood work. And he came back and he goes, "You have this M protein spike. I don't think it's anything, but I'm going to give you a referral." I'm walking into the referral the following week. It's an oncologist. And I'm like, whoa, why am I going to an oncologist? Well, within the oncologist, as a blood oncologist, he ran some more tests and bone marrow and some CAT scans. And he came back and he thought I had multiple myeloma. He goes, "Good news, you don't have multiple myeloma." My wife and I were thrilled. He goes, "But something's not right, but I think you're okay. Come back in 3 months." And he left the office. Like, okay, that's kind of weird. I'm not feeling well. I'm fatigued. My face is swelling up. I'm getting numbing in my hands. But he just said, "I'm okay." But he really didn't say. We were more confused. I was living in Charleston, South Carolina. I had a friend of mine who was a doctor do some research, and she gave me a referral, and I sent all my records to them. Took about 2 months to get an appointment. About a week beforehand, I was traveling in Chicago on business. I get a phone call. "Why were you seeing Dr. X?" And I said, "Well, because I was told I could have multiple myeloma, and I'm not sure." And they said, "Well, we're sorry to tell you this over the phone. You do have cancer. It's not multiple myeloma, so you're seeing the wrong doctor. You have this Waldenström macroglobulinemia." And I'm traveling on business. I'm in between. I was about to give a presentation to a room of about 200 people, and I just find out I have this non-curable cancer. So the moral of the story is it's so rare that even blood oncologists don't understand what it is that you have. And even when they see the results, they don't know what it is. So I would just say to anyone, when you're not feeling well and you're ruling things out, you have to see a blood oncologist specialist. So it's a tough thing. 1 out of a million people, 3,500 people a year get diagnosed with this. It's a tough one, and you have to keep chasing the answer.
Yeah, I mean, it is rare. And it sounds like, if anything, and it sounds like with the support of your family, were your own best advocate to really pay attention to your body and to continue to track your symptoms.
And now at that point, you've had bone marrow tests, where someone's drilling in your hip and taking out the bone marrow. So something's not right, and you want to be good, but you also want to find out what it is so you can face the challenge.
Right, right. And such an important tie back to your idea about education,
Right.
right? And there needing to be more education. It sounds like both in the scientific community, the medical community, as well as in the general population.
Yeah, and I'm realistic. In hindsight, it's such a rare form of blood cancer that people don't know even it exists. Even blood oncologists, they just don't see. I mean, my first doctor at MUSC in Charleston, I think I was the second patient he's ever seen with WM. And within 6 months, I think I knew more about my cancer than he did. And that was not, he was a great doctor, but if you only expect to see a couple patients in your career on it, you just don't know enough about it.
Yeah, absolutely. And so after you had the proper, diagnosis of WM, what happened next? How was that, or how did you and your family then respond?
So it was MUSC in Charleston, very good hospital. Very pleased that that was my first landing point. But as I said, my blood oncologist, he definitely researched it. He tried to come to the first appointment knowledgeable, and he spent 45 minutes with my wife and I educating us, but it was at a very high level, and it was probably good for the first time. But on the other hand, okay, I have a cancer that I'm going to have for the rest of my life. That's always going to be a challenge. Sometimes you need a little deeper. So while he's educating himself and trying to educate us, it was incumbent on me to educate myself and to learn options and treatment. My wife was a teacher at a college in town, and I was home, and we said, we love North Florida. We loved what they call the First Coast. The Mayo Clinic was there. We had family down here closer to our kids, and we decided to build a house in Ponte Vedra, Florida. I became a patient of the Mayo. Even before we moved down here, it was only a 4-hour drive, and I saw a WM specialist, and it was night and day different. Versus being the second patient my doctor in Charleston ever saw with WM, my doctor was seeing 5 to 6 patients every day, consulting around the country.
Yeah, you mentioned that the WM community is, it's a rare cancer and it's small, but also I know that there are groups out there that are also supporting patients and helping to unite, that smaller population together to have a stronger voice. Could you talk a bit about your interaction with different advocacy organizations?
Sure.
and how you've worked with them so far?
So the first group that I reached out to was the IWMF. And it's not the secret mission from the Mission Impossible team. IWMF is the International Waldenström Macroglobulinemia Foundation. And they have done more for me in the last 2 years than any other group. As they have a great website, they have great data, boiled down to the new patient, the existing patient, and they reach out to you, and there's seminars, webinars, regional chapters, national chapters. So right away, as soon as you sign on and you say you're newly diagnosed, they put in the mail, 12 different booklets helping you understand everything. So it was the best education I could get. It was something I could read. It was something I could hand to my wife. I could hand to my kids. I would just give out the web address to my immediate family, my children. I mean, telling your kids about this is probably the hardest thing I ever had to do. But once I could send them the PDFs and have them read, and while it's a non-curable cancer, it doesn't mean it's the end of your life. You know, there's so many good treatments. So it was a great resource. And I started doing their monthly webinars on different topics, and even going back to their online library and watching some webinars from the past couple of years to educate myself. So I signed up, for the American Cancer Society website, and they have seminars, the Lymphoma Society, stat.com and Cure. I mean, there's so many resources out there that, just once you start going and on one, you start seeing hyperlinks to others. So I have found a half a dozen that work for me, that I don't feel like I'm on a webinar every single week. I can pick and choose. And now that I'm a couple years in, oh, I've done that type already. I'm not interested in that, but now I'm interested in that. So it's just, my education will never stop. There's always things I need to learn. And now I like to play it forward. When I see a new patient on the Facebook group for IWMF, like confused, scared, you reach out to them. You try to help them out the same way people help you out too.
And I'm sure I know for a fact you're a wealth of information about WM, so they couldn't have a better, mentor person to help you.
There were 5 people that helped me in similar ways. It's kind of like a club, an exclusive club. And instead of getting to play golf at a nice country club, I'm helping people pick up their lives, to teach them it's not devastating, that you can lead a productive life. And yes, there are symptoms we're going to be fighting every day, and it is what you make of it. And I learned, one of the things that some other people with WM taught me was take care of yourself. It's really important to eat right, exercise, even if it's just walking for 10 minutes a day. But the better you take care of yourself, the better you feel, the better you can handle this. To get a good night's sleep, take a nap when you need to take it. Don't feel guilty that you're tired. Don't feel guilty that you're always cold. But you know what? Take care of yourself and be proactive and just make the best of it.
Yeah. So let me ask you, is there something that I haven't covered that you wanted to share, or you would share with folks, recommendations or ideas or hopes, perhaps also something that you're looking forward to in the future?
So I would just say that for anyone newly diagnosed with WM, or even the beginning couple years of their journey, is to listen and learn about the disease, the treatments, how you feel, and what your body's telling you, and to learn about clinical trials. What is my hope going forward is that, unfortunately, as people do get diagnosed with WM, the medical community keeps doing research, that there are people funding the research, and that new clinical trials are coming on. So today's clinical trials become established treatments, and new clinical trials are coming up behind it for future treatments, that eventually there's a cure for WM. It's great that there's treatments, and there's great that there's better treatments coming down the road, but we're all looking for a cure. So I would say to you guys, just keep up the great work, keep plugging away and finding a cure for us.
Yeah, we're doing our best. We're working hard. Yeah, well, thank you so much for your time, David. It's been lovely to get to know you better, and also to hear about, how educated and well-informed you are about WM. It's an inspiration to us at BeiGene and to patients, all over the country and the world.
As I think we hit upon, I'm happy to do this, because if I can help out anyone that's in the beginning of their journey, then, it's all worthwhile. Because sometimes learning, you get diagnosed, you have that fear, you're not sure what exactly, do I have 5 years, 7 years, what's my quality of life? And while there's no absolutes, learning about this and learning that you can live a great life, and there's so many good treatments coming down that are existing in clinical trials, that is what this is all about. So it's an awareness month, it's an education month, it's a hopeful month.